What doctors wish patients knew about high cholesterol. Watch until end to find your healthiest cholesterol level. High cholesterol is a common health condition in the United States. In fact, nearly 94 million adults over the age of 20 have what could be considered borderline high cholesterol, according to the Centers for Disease Control and Prevention. In this video we share what doctors wish patients knew about high cholesterol and how to lower levels. There's good and bad cholesterol. Overall, cholesterol is important for our bodies. We use cholesterol to do a variety of things. Our body creates cholesterol whether we eat it or not, and it's good to have for certain functions within our bodies. Triglycerides are closely related. Another thing to keep in mind is triglycerides, which are a type of fat or lipid that are most influenced by what we eat, and they are closely related to cholesterol. Our triglyceride levels are changing throughout the day, and they can be a risk factor for heart attack and stroke. Your body naturally makes cholesterol. One of the biggest things we see is that people think their cholesterol levels are more tied to what they eat. People tend to think if my cholesterol levels are high, that means I should eat less cholesterol. The amount of cholesterol that you eat doesn't impact your own cholesterol very much. Your body is making cholesterol. It makes cholesterol no matter what, even if you eat no cholesterol. High cholesterol runs in the family. Oftentimes, one of the biggest factors that determines your cholesterol levels is your genes. How your genes affect your cholesterol is complicated, but it's safe to say that high cholesterol tends to run in families. There are no warning signs. Typically, there are not really warning signs for people with high cholesterol. Noting there are some relatively uncommon disorders where people can get physical symptoms like lesions on their skin, but those are quite uncommon. Have your cholesterol levels tested? As for how often a person should have their cholesterol levels tested, for many people, it does not need to be a yearly test. The guidelines have been evolving about this in terms of what age you need to start getting your cholesterol levels tested and how frequently. Don't rely on behavioral changes alone. People ask a lot about behavioral changes that they can make to impact their cholesterol levels. This includes changing what they eat and their physical activity levels. We see that increasing physical activity and eating a generally more healthful diet can be helpful for cholesterol levels. Other health conditions play a role. There are many factors that contribute to high cholesterol, like genetic, family history, and our environments. Noting that we don't necessarily understand very well how our environments contribute to our cholesterol levels. Cholesterol and high BP run together. It is important to note that high cholesterol and high blood pressure tend to run together. One doesn't necessarily cause the other, but it's very common to see both in an individual. And certainly, both contribute to raising somebody's risk for heart attack and stroke. Watch your alcohol consumption. We've talked about nutrition and physical activity, but alcohol consumption can impact your cholesterol levels. Adding that alcohol can raise triglyceride and cholesterol levels in your blood. If triglyceride levels become too high, they can contribute to health problems like heart disease. Cholesterol in the blood is one of the major risk factors for heart disease and stroke. What is the healthiest cholesterol level? For most healthy adults, 19 and older, your total cholesterol should be less than 200 mg/dl, your LDL less than 100 mg/dl, and your HDL greater than 40 mg/dl. For children, 19 and younger, total cholesterol should be less than 170 mg/dl, LDL less than 110 mg/dl, and HDL greater than 45 mg/dl. Watch your health and stay healthy. Don't forget to subscribe, likes, share and comments. Cheers!